All right, we'll go ahead and get started. Thank you all for being here for our COVID-19 vaccine media availability. We have two guests today from Northern Nevada Medical Center, Dr. Anderson, as well as Melody from Renown Health. We'll go ahead and start it off with Renown Health. Stacy Sunday, would you like to provide the introduction?
Thank you. Good morning, everybody. It's my pleasure to introduce Melody Osborne from Renown Health. She's our Chief Nursing Officer of the Health Services Division. She's going to give a brief update about what's going on with vaccinations at Renown, and then she'll be available to answer any questions you have. Hi, Melody.
Hi, good morning, and thank you for the opportunity to provide an update. So on January 14th, we began vaccinating the general public aged 70 and older, and to date, we have completed over 17,000 vaccinations to include our medical staff members, our employees, students, and seniors in our community. One of the calls that we continue to get from our community is about the weather and whether or not we're going to continue with our vaccination efforts. So I wanted to let the group know that weather is not stopping us from stepping up for immunity. Our COVID vaccination events continue throughout the winter. We want those who have a confirmed appointment for the COVID vaccine clinic this week to know that we are ready to provide those vaccines despite the weather and still plan on completing those vaccinations. We just ask that those who are scheduled for those appointments attend their scheduled appointment on time and plan for extra travel time as well as some additional wait times, and to just stay safe on the road. And again, all those that are eligible for the vaccine, age 70 and older, to have a Renown MyChart account, you should receive a ticket to schedule and will be on the waiting list. Just please be patient. There are many on the waiting list for the limited supply of vaccine, and you will receive that ticket to schedule once you have completed that MyChart account. So those are the updates that I have for today, Stacy.
Thank you very much for that, Melody. Appreciate that. Now we'll move it over to Dr. Travis Anderson from Northern Nevada Medical Center. Dr. Anderson, if you could give a brief kind of intro of who you are and your role at NNMC, and give any status update regarding COVID-19 vaccine.
Sure. Good morning. Thanks for having me on. Dr. Travis Anderson. I'm the emergency physician and also the medical director for Northern Nevada Medical Center and our ER at North McCarran. Our current status with vaccines is we're allocated only vaccines for our medical staff. We have completed the second dose for nearly every single person that wants those vaccines. And we're currently working on getting some for our patients as well. Regarding COVID-19, we've shown a slow reduction in cases that we see, similar to Washoe County and some parts of the nation, which is great. We're still seeing high severity illness as well, but our rates of infections and patients we're seeing and severity are very consistent with the rest of the county and our other hospital sites. We're still very well stocked on our PPE. Our staff is remaining well and not seeing a lot of transmission to our staff members. So we feel very good about our current status, and hopefully we continue on this trend.
Okay, appreciate that update. Thank you very much. So we'll open it up to Q&A for both of our guests from Renown and Northern Nevada Medical Center. We do not have Jim English, who's our operations sector chief for the COVID-19 vaccine deployment. So he won't be able to answer any questions, but if you have Washoe County questions, feel free to ask. I'll try to answer. I'll probably just not answer them because I'm not as aware of everything as Jim is, but I can help get that answer if you need to. So if anybody has any questions, feel free to start it off.
This is Paul Nelson with 2 News. My first question is for Dr. Anderson. Just how valuable is it that most of your staff now has had their second dose and they can go on with their work without really having to worry as much about contracting this disease?
Well, I think the mental burden of the last year with this pandemic has been extreme, and I think a lot of staff feel a lot safer now having the vaccine. We're still maintaining the same level of personal protective equipment and infection control regardless of vaccinations, which I think is appropriate for the time being. Our staff is happy about it. We've had a very high vaccination rate. And I think it'll be essential to reduce any infections that are passed from staff, both in close contact in the hospital, or even we've seen in some of our less acute care facilities that we could have passed infections to patients incidentally. So the last thing we want is our staff members to be the focal point of any infection spread. And we've done a very good job with that before the vaccine, and it just adds that extra level of protection.
And then you mentioned that you guys are working on eventually vaccinating patients. Are you guys thinking about setting up your own drive-through type pod, or how are you guys planning on vaccinating patients?
So we have an extensive primary care group in multiple sites all across town, not just up in Sparks. So we have the ability to distribute these in many different ways, and we have plans for all kinds of different avenues, just depending on what the allocations are. But, the state gets the amount of vaccine that they get, and the best thing for our community is to distribute those to the most efficient facilities that can do that now, which right now Renown and St. Mary's are doing a great job of getting it out to our community, as well as Washoe County with their drive-through. So when it comes to a point that there's enough vaccine to distribute to us to be able to assist in that, we'll announce our ability to do so.
Is that something you guys are excited about, to kind of do your part as one of the partners?
Absolutely. I know a lot of our patients and community members are worried and they are on wait lists and they want to get vaccinated as soon as possible. And we want to do our part and assist the best we can. And when we're able to do so, we certainly will do so aggressively.
I've also got some questions for Melody. So with the drive-through pod that you guys are doing, how successful is that working? How many people are you guys vaccinating every day?
Yeah, thank you for that question. So on any given day, we are vaccinating about 1,000 community members. For the most part, the process has been very smooth. However, with the weather this week, that has created some additional challenges for us in terms of safety, making sure that our staff are safe out in the parking lots and that our community members are driving safely. So that has been a challenge, but all in all, it has been a very smooth process.
Is the weather causing some people to call in and cancel their appointments?
No, that's a great question. We did anticipate with the weather that we would see a high no-show rate. We actually have not seen that at all. What we have seen is people are showing up much earlier for their appointment, which is causing some additional delay with more patients in the parking lot than anticipated.
What kind of response are you getting from the seniors that are coming in there and getting their vaccine?
I have to say it has been such a remarkable and humbling experience. Every patient that we have been interacting with has been incredibly appreciative and grateful and thankful that our staff are out there really just trying to support the community and get those vaccinations out.
And then kind of like what I was asking Dr. Anderson, how is Renown doing in terms of the vaccination of your own personnel? Where are you guys at with that?
We have a very high vaccination rate with our staff. And while our staff feel that sense of comfort that they have that vaccine, we have to continue to be vigilant in utilizing our personal protective equipment and ensuring that we are wearing our masks. But we have had a very high vaccination rate.
Is it just Paul with the questions today, or does anybody else have any? Okay, we'll go ahead and wrap it up unless anybody has anything else.
I'll go ahead and ask one more.
I got a question too, Scott.
You go ahead.
Okay.
You go ahead.
Scott, any major updates since the other meeting? What was that, Monday or Tuesday, as far as availability of vaccines? I know I think I had read, or maybe you sent something out that we do anticipate getting more supplies from the feds. Where are we on that?
Well, we tend to get notification about how many doses we're going to get, usually on the Friday, the week prior or the week before. So hopefully we'll find out more tomorrow on how much we're getting next week. But we're expecting it to be pretty stable to what we received this week. To put that in perspective, our second doses actually went up for the amount that we got this week as opposed to last week. But the first doses was where we saw the actual decrease, and it went down pretty significantly. So we're hoping to keep getting more first doses as well as second doses, just so we can really start to get more people vaccinated in the community. And then one point to clarify, they're the same dose. It's just they're pretty much earmarked for the second dose, so we know that we make sure that we're vaccinating the people that need to come back and get their second dose.
So no change from Monday?
Well, hopefully we'll find out a little bit more tomorrow, but I haven't heard of any expectation that it was going to be a significant difference.
Thank you.
And then Paul, you said you had another one?
Yeah, for both Renown and Northern Nevada, is the speed in which the vaccine is coming in, is that frustrating at all for you guys? I know with Northern Nevada, you guys haven't been able to start yet. I don't know if that affects you guys as much over at Renown, but is the allocations, is that frustrating for you guys?
Well, I think over the last couple of weeks, we've seen actually a really strong allocation. I think where we have been challenged is making sure that as we're getting that allocation, that we have the staff in place to help deliver the vaccinations at the rate that we'd like to deliver them. So I think that's been the challenge. I know there's a concern with allocations over the next couple of weeks, but so far we've seen good allocations.
Yeah, I would agree. I think especially Northern Nevada has done a really good job at getting the vaccine and distributing it quickly. I think Northern Nevada, for their staff, was able to get first doses within just a couple of days to nearly the entire staff for our allocation. And it is frustrating. I think most states are seeing that. I think part of that is when you do really well, and we've done well with our intra-hospital infection rates and with our businesses and trying to keep the infection rates down. But when you do well, that means you're not as much of a hot spot to get the higher allocations. So I think we're right in the middle of that area right now, where the government's trying to get us as much as possible, but there are other hotspots in the nation that are trying to get more allocation. So it's frustrating from our end not to be able to help our community, but we're just lying in wait to help support the other sites to get these vaccines out as fast as possible.
Any other questions? All right, we'll wrap this up. This meeting was being recorded, so like all of our press briefings, they will be loaded to our covid19washoe.com/press conferences page, where you can see all of the ones that we've done in the past. We will meet again on Monday at 11 a.m. and I'll make sure we have a health district operations staff member to answer some of the questions regarding orders for next week. If you have anything further, please feel free to reach out to me. And thanks to Melody Osborne and Dr. Anderson for joining us today. Have a great week. Have a great day. Thanks.
Great. Thank you. You too.
Thank you. You're welcome.